whether somebody's critical about it or not, whether they like the fact that other people are using it or not, it's here. It's going to happen. It's a good thing, but we need to learn how to use it.
Who should be using Ozempic? Why is this particular pill become such a craze? Because there have been weight loss pills around for so long, but like you said, it kind of has been coming hand in hand with some shaming and maybe people that are using that shouldn't use it.
I think we have to stop immediately the Ozempic shaming. It's preventing us from sharing our experiences. Listen, we don't know how to use these miracle weight loss drugs in non-diabetics. Particularly, we don't know how to use them in patients who only have 5 to 20 pounds to lose. So we need to share our experiences. We're learning as the patients are learning what the side effects really are. A lot of people are ending up in the hospital. A lot of people are getting sicker than they've ever been before. So it's really important that we celebrate that we actually have a breakthrough in treating obesity. So it's really an exciting time, but it's also a very scary time. It's going to change the very nature of our bodies and what's happening with our physiology. And it's a new frontier. It's exciting, but it's also very dangerous. So share your experience. And if somebody's on Ozempic, talk to them about it and make them feel good about it.
Yeah. But and the thing that we've heard before in the media is that there's a big shortage. So they're saying that the patients with diabetes or pre-diabetes, they don't have enough medication for them to take, or the prices are going up. That may be true, obviously, because they've been around for a long time and that is original use of it. So there is that to consider, and we'll see if there will be multiple different types of these semaglutides coming out. The second thing too, one thing that people should know about is you lose muscle mass also with it. Because remember, you're not eating. Remember, you need that protein. You got to make sure you're doing it always the right way. And so no matter what, this is kind of the newest thing, and that's why it's not necessarily a botched thing, but we're just talking in general about giving information a little that we know right now.
Definitely. But, you said that this is for obesity, but there have been several housewives that have come forward saying, I've taken this to kind of kickstart it. They're clearly not obese. Should they not be taking it?
I think anyone who wants to control their cravings, who wants to lose a little bit of weight. It's even been shown to be useful for gambling addictions, heroin addictions, alcohol addictions. This is a new time where we're able to control our cravings and get control of our behaviors. So whether somebody's critical about it or not, whether they like the fact that other people are using it or not, it's here, it's gonna happen, it's a good thing, but we need to learn how to use it. So don't make people feel bad about it. It's going to be in the drinking water very soon. It's going to be as common or more common than Botox. And this is being studied at a very high level. There's articles written even last month in the New England Journal of Medicine using Mounjaro in non-diabetics, and it's extraordinarily effective. That article showed that in a year's time, patients lose 26% of their body weight very quickly. So it's effective. I think it's used properly. It's going to be safe. So celebrate it, enjoy it, and don't make people feel bad about it.
No, I mean, it seems like this is a breakthrough drug. I mean, would you consider this, I guess, the new Botox? Like everybody's going to be using this?
Yeah, I mean, absolutely could be. And again, remember, there are the side effects. I mean, I have high hemoglobin A1C. Pre-diabetic, and this was years ago. So I actually, before everyone knew anything about the weight loss, even though that was one of the things that says it will do on the, I couldn't handle it. I took some, maybe a small amount, and I was throwing up all the time. And now I will tell you something, anytime there's a new drug, one thing, just like Botox, for example, they're using it for all kinds of different uses, from sweating to migraines, all kinds of things, back spasms. And so with this, just like Dr. Dubrow said, they're going to find, God willing, many positive and different uses for this. And of course, there'll be the negative ramifications, and that's how you learn about a drug.
Listen, these Ozempic type drugs aren't the new Botox. They're better. They're Botox, liposuction, breast augmentation, facelifts. Put it all together and you've got a drug that's not only making people look better and feel better, it's treating the #1 risk factor for heart disease, diabetes, and cancer. So this is an incredibly powerful, positive thing that is truly the most significant, I think, medical breakthrough in history.
That's a big statement.
That's a huge statement.